Abicin 250, a guide to its uses, precautions, and more. Abicin 250 is a semisynthetic antibiotic containing amikacin as its active ingredient. It's available as a lyophilized powder for injection, packaged in a vial with 250 mg of amikacin and a separate vial containing 2 ml of sterile water for reconstitution. This antibiotic is commonly used to treat Virginia. 1. What is Abicin 250? Abicin 250 mg contains amikacin sulfate, which is a semisynthetic aminoglycoside antibiotic. Mechanism of action: rapid bactericidal effect. Amikacin works by binding to the 30s subunit of bacterial ribosomes, disrupting protein synthesis within the bacteria. This leads to bacterial cell death. Mechanism of action: post-antibiotic effect. Amikacin continues to inhibit bacterial growth even after its concentration in the body drops below the minimum inhibitory concentration (mic). Spectrum of activity: aerobic gram-negative bacilli effective against a wide range of bacteria including Pseudomonas aeruginosa, Escherichia coli, Klebsiella pneumoniae, Proteus mirabilis, Serratia marcescens. Spectrum of activity: Acinetobacter baumannii, Pseudomonas aeruginosa, Escherichia coli, Klebsiella pneumoniae, Proteus mirabilis, Serratia marcescens. Spectrum of activity: Acinetobacter baumannii. Important note: amikacin is ineffective against anaerobic bacteria, those that thrive in oxygen-deprived environments, and its activity is limited against most gram-positive bacteria. Pseudomonas aeruginosa, Escherichia coli, Klebsiella pneumoniae, Proteus mirabilis. Spectrum of activity: Serratia marcescens, Acinetobacter baumannii. 2. Using Abicin 250 dosage is determined by the doctor based on the severity of the infection, patient's overall health, kidney function, and age. Administration: Abicin 250 is administered intravenously, often as a slow infusion. Administration should be done under the supervision of a healthcare professional. 2. Using Abicin 250 duration of treatment. The duration of treatment depends on the severity of the infection and the patient's response to the medication. Contraindications: allergy: individuals with a known allergy to amikacin or any other component of the drug. Severe kidney disease: individuals with severe kidney impairment should not use Abicin 250. Hearing impairment: vestibular disorders: individuals with pre-existing hearing loss or vestibular balance issues. Precautions: kidney function use with caution in patients with impaired kidney function, as amikacin can accumulate in the body, potentially causing toxicity. Liver function use with caution in patients with liver disease, as amikacin can be metabolized in the liver. Precautions: heart function use with caution in patients with heart disease, as amikacin can affect heart rhythm. Age use with caution in elderly patients and children, as they may be more susceptible to adverse effects. Precautions: pregnancy: Abicin 250 should not be used during pregnancy, especially during the first trimester. Breastfeeding: amikacin can be excreted in breast milk. Exercise caution when breastfeeding. 4. Potential side effects: gastrointestinal nausea, vomiting, diarrhea, constipation. Neurological: dizziness, tinnitus, hearing loss, tremors, seizures. Hematologic: decreased white blood cell count, decreased platelet count. Renal: acute kidney failure, increased creatinine levels in the blood. 4. Potential side effects: musculoskeletal: muscle weakness, muscle pain, muscle cramps. Other allergic reactions: rash, itching, hives, anaphylaxis, and more. 5. Drug interactions: Abicin 250 can interact with various medications, including diuretics. Diuretics can increase the risk of amikacin toxicity. Other antibiotics: certain antibiotics may interact with amikacin and decrease its effectiveness. 5. Drug interactions: nonsteroidal anti-inflammatory drugs. NSAIDs. NSAIDs can increase the risk of kidney damage when used with amikacin. Chemotherapy drugs: some chemotherapy drugs can increase the risk of hearing loss when used with amikacin. 5 Drug interactions. Antidepressants. Certain antidepressants can interact with amikacin, increasing the risk of side effects. 6 Storage and handling. Store Abicin 250 at room temperature in a dry, cool place, away from direct sunlight. Keep out of reach of children. Do not use the medication if it has expired. Important note: this information is for educational purposes and does not replace the advice of a healthcare professional. Consult your doctor or pharmacist before using this medication. Adhere strictly to your doctor's instructions for optimal treatment outcomes and to minimize the risk of side effects. Important note: report any side effects promptly to your doctor for immediate management.